It's a good question. I think that sexuality is one of the most common and natural and life-affirming experiences that adults have throughout their lifetime. I think that's the case for both cancer survivors and non-cancer survivors. I also think that sexual health is not just an important aspect of quality of life, but it's an aspect of quality of life that often doesn't get talked about. So it becomes something that is often the elephant in the room. When cancer survivors are asked how they're doing, people will say fine, often struggling with this issue and not really having a voice or a place to talk about it. The good news is that there actually is a lot of information that's directly available to patients and survivors now, much more in this area than there was even 5 or 10 years ago. So there are a number of very concrete resources that people can use, for example, from the American Cancer Society, from the National Cancer Institute, that are available both in hard copy and online, that have very concrete tips. In terms of specific tips, for example, for women and for men, I really think it's important that women think about vaginal health as much as sexual health. I think if any woman is dealing with any kind of pain or discomfort or vaginal dryness, she needs to get educated about what to do to take care of that part of her body. So that means very concretely learning about vaginal moisturizers, learning about how to use lubricants, learning about how we can increase blood flow and tissue elasticity with strategies like pelvic floor physical therapy. There really are a range of very concrete tips that are available to everybody who wants to learn about them that can make a very big difference, and you don't need to get professional help to learn about those tips as much as just to be able to get online or do some reading. Similarly for men, I think there are a number of terrific websites and resources for cancer survivors that can give very concrete strategies to learn about how to deal with issues like erectile dysfunction. Again, the good news is that there are more options now than there used to be. I think that especially for us here in Massachusetts, we actually have a couple of sexual health programs that are based in sort of cancer centers that are sort of not typical across the country, but that are really sort of provide a wealth of resources for our survivors. And similarly, there are individuals often within oncology teams, whether they might be nurses, social workers, who have particular interest or expertise in this area. I think for patients, the #1 tip is that you have to feel like you can have a voice to go to somebody on your treatment team and say, you know, actually, this is a part of my life that's not going as well as I'd like it to be, and is there someone I can talk to about it? One of the classic issues we see when we do surveys is that we know survivors are stressed and struggling with this issue, but don't want to embarrass their doctors. We know that doctors and nurses will say this is a very important topic, but they don't want to embarrass their patients. So we have a funny, again, elephant in the room, and there's a real sense of a sort of a funny dance in a way that nobody wants to sort of break the ice. Most importantly, I think it's critical that survivors feel empowered to say something, and that, you know, typically it might not be that your oncologist or that the person in the room is necessarily the expert, but they can likely guide you to who you might be able to talk to, whether that's sort of on your team or in your institution or at the hospital.